Guys, let's discuss the portal vein. The portal vein is, what's that? Portal vein.
It's in the veins that drainage the digestive systems
Yeah.
to the liver.
It's blood vessels which takes blood from our gastrointestinal tract, right? It's including the appendix, cecum, colon, the rectum, and the small intestine, right, in the stomach, and brings right into the liver in order to detoxify, to metabolize some structures. Okay, portal vein is made up by two big branches. The first one is lienal vein or splenic, and the next one will be superior mesenteric vein. The lienal vein, into the lienal vein we have another mesenteric inferior vein, right? Is it clear? And we should now write down the branches which drains into the lienal, into the superior mesenteric arteries. In this picture you can see all the organs, the liver, stomach, spleen, and so on. And let's talk about first the branches of superior mesenteric artery. Superior mesenteric, vein. Yeah, superior mesenteric vein. What are the branches of superior mesenteric vein? Yeah, we should keep in mind this is our superior mesenteric vein, and into the superior mesenteric vein we drain some jejunal veins. We have ileal, yeah, ileal, right? Ileal, yeah, appendicular, the veins from the appendix, from the cecum, yeah, and from the left colic, yeah, right colic, and we have colica media. Everything drains into the superior mesenteric vein. At the same time we have some branches from pancreas also, right? And that was the branches of the superior mesenteric vein. Now let's take some branches from the inferior mesenteric. Inferior mesenteric gets blood. The first is superior rectal. It's really important point. Why? There is anastomosis between median and inferior rectal. That's the branches of inferior vena cava, right, from the iliac veins. Then the another branch will be sigmoid vein. Then we have jejunal, some ileal branch that drains into the inferior mesenteric. At the same time we have left colic, right? Left colic drains, and we get blood from the pancreas and drains into the which vein? That was inferior mesenteric vein, and that one will be splenic vein. The splenic vein gets blood from the spleen and goes to the side of the liver, but along its course it gets some blood from other parts. It will be the stomach. Which branch of the stomach drains into the splenic vein? Gastrica sinistra. Wait, no. Gastrica brevis. Gastrica brevis drains into the splenic vein. And we have on the major curvature of the stomach, we have one big vein. What's the name of that? Gastroepiploic sinister drains into the splenic vein also. Okay, and gastrica brevis we told, gastroepiploic sinistra, and it will be getting blood from the pancreas, yeah, and it will go to the liver, and after the fusion, after the joining with superior mesenteric vein, now we have portal vein. Into the portal vein we have right and left gastric drains into the portal, yeah, and we have gastroepiploic, the right drains into the portal. Okay, the same time we have which? Cystic vein drains to the portal. We get all the blood from our GIT, then drains into the liver in order to detoxify, metabolize, right? Metabolize, and then it drains into what? Into inferior vena cava, and the name of this vein is What's the name of this vein? Hepatic vein. It drains into inferior vena cava, right? And I want to tell you some anastomosis. It will be anastomosis, portacaval anastomosis, if you remember. The portacaval anastomosis right here, one, right? And we have some in the gastric brevis. It has branches to esophagus also. And we have esophageal branches from azygous vein, hemiazygous vein. You remember? There is anastomosis between portal and caval systems. Is it clear? It's just superficial, some anastomosis. And then the last branch is in the ligamentum teres hepatis, inside of teres ligament, round ligament of the liver, there is some branches. What are they? Umbilical vein. They form anastomosis with which branch? Who knows it? Epigastric. Which one? Yeah, there is superficial and then some branch of the inferior also. And so we have, look here, this is clinical knowledge. Sometimes the patients could have some serious health conditions. It's called, let's talk about the liver cirrhosis. You know what this means, liver cirrhosis? Yes. The replacement of the liver tissue with connective tissue as a result of different kind of problems, different kind of causes. I would say it could be a viral infections, the bad drinking habits, and autoimmune disease. There are so many. For example, we can say when the liver tissue is replaced by connective tissue, the blood will not drain. We cannot pass to other part, right? It will lead to blood accumulation where blood will accumulate inside of the liver. When blood accumulates inside of the liver, it will lead to increase in size of the liver, right? It will increase, right, in size. It will become big. This sign is called hepatomegaly. Look here, and this condition, when the blood pressure inside of portal system is increased, is called portal hypertension. Do you understand what I mean? There is a problem in the liver. There could be a problem in the hepatic vein, in the portal, or it could be here. It can lead to the increase in the portal system blood pressure. It will lead to the hepatomegaly, and it can lead, if blood accumulates inside of the spleen, it will lead to splenomegaly. It will increase in size also. Splenomegaly. You see it? Splenomegaly. And we have some anastomosis, right? The blood stops right inside of these veins, and it will try to cross, it will try to find another way to leave this system. That system will be some portacaval anastomosis. They will try to bypass this system and they will go to the caval veins. Is it clear?
And this hepatomegaly can be reason with the fluid in the abdominal.
Yeah, easily. But there are, he's talking about ascites. There is a condition, it's called ascites, fluid accumulation inside of peritoneal cavity. The fluid accumulates when we have increased blood pressure in portal portal system. The blood leaves, the fluid leaves the blood vessels, the venous system, into the peritoneal cavity. The accumulation of fluid inside of peritoneal cavity is called ascites. Is it clear? And we have these kind of patients with portal hypertension. They can have bleeding from the esophageal veins. It will lead to the blood inside of the stomach, and it can bleed inside through the rectal veins. That was the portal vein explanation. Do you have any questions, guys? No?